IVF is associated with lots of myths, but if you have any doubt, please consult with the doctor first. Don't rely on what you have heard from your friends or relatives. Hello, I am Dr. Sujoy Dasgupta, Director of Clinical Services of Genome Fertility Centre, Kolkata. Today, we are going to discuss about the myths and misconceptions regarding IVF. IVF is associated with lots of myths, but if you have any doubt, please consult with the doctor first. Don't rely on what you have heard from your friends or relatives. The first misconception is that IVF is the only treatment for infertility. It is not true. In our clinics, many women conceive with natural methods, ovulation induction, or some with IUI. Therefore, when you come to an IVF center or fertility clinic, that does not necessarily mean that you are going for IVF. There are lots of treatment options. There are very few couples who can't conceive without IVF. Number two is that IVF is very much painful. This is very wrong conception. Remember, IVF has different steps. Number one, you have to take number of injections, but injections are not painful. Injections are taken under the skin just like insulin, therefore it should not cause pain. Next, egg collection of IVF procedure is done under anesthesia, therefore there is no question of pain. Thirdly, when we will do the embryo transfer, that is when we will put the embryo inside your womb, that may cause little discomfort, but it is not painful. Therefore, IVF is not at all a painful procedure. It is not painful. That's why lots of women are going through IVF. If it is painful, then probably most of the women would have avoided it. Therefore, please remember, IVF is not at all a painful procedure. Number three myth is that after IVF, you have to take complete bed rest. This is totally wrong. Bed rest, what it will do? It will give some psychological benefit. It will give you some reassurance psychologically that yes, I am doing something. But remember, bed rest will not increase the success of pregnancy. It will not increase the chance of pregnancy, and bed rest will not reduce the risk of miscarriage. Rather, the bed rest will increase the chance of pregnancy complications. Therefore, we no longer advise bed rest after IVF. You can attend your office, you can go to your school, you can continue your household activities, everything can be normal. Because after pregnancy, it is just like other pregnancy. Just because you have done IVF, that does not mean that you have to lie down on your bed throughout the pregnancy. Another myth is that in IVF, the babies would be abnormal. Remember, there are lots of reasons for abnormalities in the baby. The most common reason is some genetic problem. Next, there may be some environmental problem, or there may be some drug exposure. Babies may be abnormal in normal conception as well. Similarly, babies may be abnormal after IVF. That doesn't mean IVF is responsible for abnormalities in the baby. Babies can be abnormal after IVF, but that is not related to IVF itself, which means IVF does not increase the chance of abnormalities in the baby. Moreover, nowadays, in each pregnancy, whether it's conceived naturally or conceived by IVF, we do certain tests to detect the abnormalities in the baby. After IVF, the similar test will be done on you. Therefore, rest assured, IVF is not responsible for causing abnormalities in the baby. The last misconception is that IVF will take long period of time and you need to take a break from office for long period of time. This is also wrong. Of course, you have to visit the doctors frequently, but in the meantime, you can continue your day-to-day work. Even after visiting the doctor, you can go to your office. Therefore, there is no need to take leave from office for a long period of time. Still, if you have further queries regarding IVF, particularly if you have heard something which you don't know whether it's correct or wrong, please don't hesitate to contact us through our Facebook page or YouTube channel. Thanks a lot.